Local programming on KRWG made possible in part by viewers like you. Thank you.
Welcome to A Special Fronteras, A Changing America. I'm Edmundo Resendez. Today we begin a new series on mental health titled From Stigma to Treatment, Latinos and Mental Health. Throughout the year, we will air special programs dealing with Latinos and mental health. Today, the focus of the program is on the impact of Latinos and mental health along the border. Undiagnosed mental health issues and self-medicating through drugs and alcohol are combinations that Dr. Eduardo Rivera sees with newly arrived immigrant communities.
There's some cultural aspects that makes the whole experience even worse. The typical Friday nights, the typical weekends where the men just go out and get drunk, and then that borders into some uncontrollable behaviors that produces some very unfortunate situations in the family. And so you have to deal with those kind of phone calls in the middle of the night, and just, you get to those houses and the police is already there. And
one solution to addressing these problems in colonias and border communities is through promotoras. Promotoras are recruited from the target community and employed as integrated staff members in each partner organization. Ron Gurley has seen the work of promotoras firsthand and believes that they can make a difference.
We have promotoras that work through and around through the county health department that have received training. They're out there. There's people that are particularly in our colonias where there is a lack of trust about the outside world for many, many reasons, particularly with the undocumented. But the promotoras are individuals that are peers that they can trust. They can convey information and help people get help. And I think we need to amplify that. And here, probably more so than any place in the country. The promotora approach, I think, has got some real merit to it.
My guest today is Devora Kestel, Regional Advisor in Mental Health with the Panamerican Health Organization, the World Health Organization in Washington, D.C. Devora, welcome to A Special Fronteras on mental health. Why don't we start out the conversation by talking about the role the Panamerican Health Organization plays as it relates to mental health.
Okay, first of all, thank you for having me here and giving us the opportunity to share some of these things we are doing around. The PAHO, the Pan-American Health Organization, works with the member states of the region of the Americas, from Canada to the South Argentina, let's say, to support countries in improving the answers their governments can offer to the needs of the population in the area of health. That's what my organization does. In the area of mental health, that is what I'm working on, is again trying to find answers according to each country's situation and possibilities to answer to the needs of the mental health needs of the population, which means from developing policies and plans on how to do things to drafting new legislations that will protect and promote the human rights of mentally ill and their families, and revising the organization of services and improving the possibilities for people suffering from mental disorders of any kind to find an answer to their needs.
Worldwide, and in your involvement with this organization, how are other countries working with mental health issues?
Well, the situation is very different from country to country. There has been a tendency over the last 30 years, 40 years probably already, to move from the traditional mental institutions towards the community, developing services in the community with beds in the community in general hospitals or in residencies, but also with day services and any other kind of complementary service that could answer to those needs that are so diverse. Some are very intense and some may be softer, but still we need for an answer. And so the countries organized their services in a variety of ways, but there is this tendency to move to the community, to develop services in the community, at the community level, to avoid the isolation that patients secluded in mental hospitals could have. And in many cases also, the hospitals have played a custodial role rather than a therapeutic one. And again, in many cases, we know about violations of human rights, etc. And then that has why the tendency to move services in the community has been born back then.
Well, one of the lines that I read in one of your reports is that mental health as a human right. You know, and that was very intriguing that, you know, your organization really views it that way.
Oh, yeah.
How is mental health, let's bring it closer to home, dealt with in Latin American countries, from Mexico down to South America?
Again, there are very good examples of services brought to the community with mental hospitals that have been closed or drastically reduced the number of beds concentrated in one place to disseminate and decentralize the services in the community. And when we talk about protecting the human rights of people with mental health issues, is because historically, although the institutions were born to take care of those people, actually they were converted into a place that people with mental health has been mental health issues have been segregated from the community, isolated somewhere. You know, I don't see them, so I don't think about them, and I don't care about them at the end of the day. And the distance sometimes where those institutions are located creates a distance with the family that may not be able to visit and to travel and to keep a contact. So at the end of the day, the person is really isolated. And that's, health is a right. Right? So one of the basic human rights is the right to health. Mental health is health. It's one component of health. There is, we say there is no health without mental health. And the definition of health by the World Health Organization is the complete a state of wellness, physical, mental, and social. It's not just physical health what counts. So mental health is also a human right. And we need to protect the rights of those people suffering from mental illnesses, which means offering them a treatment that is of the highest quality possible, that will respect the rights of the person, that will protect them from abuses from others, because frequently the mentally ill are a vulnerable group, vulnerable to many others in the society that may ignore them or abuse them. But also in terms of the dynamics with the family, that sometimes the family is overwhelmed by the problem, and you need to protect also their rights to, and receiving care, receiving health care treatment is one of the basic things we can do to protect those rights, to ensure that rights are protected.
We're in a very unique situation in that, you know, we have a border that deals with, you know, with Latin America, and there's immigration, both legal and illegal, that comes into this country. How is the United States and bordering countries like Mexico and Central America, is there a conversation between these countries on mental health issues that will impact the immigration into the United States?
Let me say before this, let me answer you with giving you some other information other than what I said, and is that globally, we know that developed countries, and we can place there the US definitely, they have what we call a treatment gap, which means the number of people who suffer from mental disorders who do not receive treatment, a treatment gap. The developed countries have something that goes around between 35 and 55% of people with mental disorders, severe mental disorders, that do not receive treatment. Developed countries. Developing countries have that treatment gap higher. So we are talking about up to 85% of people with depression, around 70% of them, 60-something% of them do not receive treatment. People with schizophrenia, that is a very disabling disorder, we may go around 50% of people not receiving treatment. So some of the countries that you are mentioning from Central America or Mexico are still struggling with developing services that can offer treatment to these people. Now the US has its own very sophisticated system, but still they are having problems with that, and we are recently following up on the news frequently, right? Some of the issues that they are still trying to overcome. So nobody has a perfectly functioning system. Now, in this border, like in many others, the people that immigrate, that cross the border, usually are people that are going away from problems, going away from a difficult situation already. And so you have a concentration of problems. I would say that I don't have the statistics of the number of people in this region that has this or that problem. Globally, there is a common number that moves from country to country of percentages of people with a diverse mental disorder. So we assume that similarly the numbers could fit here, the number of people with depression, the number of people with schizophrenia, etc. The problem, the added number here would be that people come with already probably some difficulties and some stressful situation into another stressful situation. Because there are those who migrate. I'm an example. I left my country many years ago and went somewhere else because I wanted to explore other options, and I found a job and I stayed, and so it was an easy immigration. People that migrate in general across the border are people that are just struggling to find a better situation. So to the problems or difficulties they had, you are the ones of being somewhere else. So we assume, although we don't have figures, we assume that the needs are big.
Well, you talk about the gap, in between, developing countries and the United States. It tends to be very wide, which means that a lot of immigrants that are coming into the United States might not be aware that they're suffering from mental illness, and they come into this country into what is a stressful situation. How can Latino communities raise awareness to some of these issues? And are there examples of where there's been some successes of some of these communities raising awareness to mental health issues?
Well, I'm not aware of examples in this region, although we have been trying to do something. But related also to your previous question, I'm here today because we are part of a project that is a project shared by the U.S. government, some institutions within the U.S. government and PAHO, to find modalities that could work both sides of the border in terms of increasing knowledge, increasing awareness, and increasing literacy around some of these issues, and finding solutions to treat, which means treatment, but means also some social support, sometimes means also some other issues that are not necessarily the most sophisticated clinical treatment. It's simply finding an answer to other needs that the immigrant may have. I'm sorry. Needs that may be related to not knowing where to go to look to seek for help, for example. That could already be a barrier to get help, because you don't know where to go. You don't know the context you are in, right?
Well, one of the things, in doing research for this project that frequently comes up is the role of spirituality that plays in Latino cultures, the role of familia, coming together to lend support without there being seeking traditional treatment, What cultural considerations are in play as we look to, again, educating the community about mental health issues that they might be suffering from?
Well, that's very important because the culture plays a huge role. And as you said, spirituality and familia plays a big role in Latino community. I had the opportunity to work in different cultures in different countries around the world, and there is always spirituality, familia, that plays a role. That is different from place to place, but there is always a role there that needs to be played in, let me say, a smart way. How do we communicate? How the different actors that are supposed to contribute to provide that help, how do they communicate with each other in order to ensure that the priests in the region where we are working or we are discussing about the problems are informed about what's going on, what services are out there, what kind of support they could provide. How do we ensure that their support is going into a right direction, and how can they also refer to the health services, and how the health services could refer to them? How can you establish that bridge, those channels of communication both ways, in that we educate each other and we learn to respect each other and to collaborate each other? That would be in terms of the role of the spiritual leaders, for example. That is very important, because many people, as you said, they don't go to the doctor, they go to their priest to talk about their problem. Now, some priests are very involved and willing to collaborate. Some others may pay less attention. How do we work in order to ensure that everybody is aware of the possibilities and the resources that they have, but that in the meantime they count with the support of the health system, because otherwise they are also isolated and abandoned in the same way the families are. And the same is valid for the families. There is a lot of basic education that can be done at the family level, at the mentally ill themselves. We call it psychoeducation in some context, for the mentally ill, for their family, self-help groups that could learn from each other among service users or consumers or peers, depending how you want to call them, but also family members. What role can they play? At the level from the simple, basic, light disorder to severe ones, they all can play a role, and I think it is responsibility of health providers and health-related organizations to work in that direction.
Well, as we talk about again, spirituality, the role that plays in it, and the family. One of the things that's come up as well is the role of traditional healing, by Latino cultures that involves, the use of home remedies, healing through prayer, and curaderas. What role is there for these type of traditional healings that could be successful in the Latino community?
I think that as everything in a right amount of it could be helpful, not too much, not too little, in a way that sometimes through that the person is receiving attention and support, and that is what he or she needs. So that would be okay. Sometimes it needs more than that. So again, how do we communicate with these people? I was recently in a workshop a few months ago in the Caribbean countries, and I was amazed by learning from the doctors there the relationship they have with some of the curanderas or the traditional healers. How they establish, again, a channel of communication, so that it was, one doctor was telling me how one day he received a lady who he referred to Doña Maria, and she said, well, I am Doña Maria. And they have been making referrals to each other for a few years. Eventually, she had a problem. She came to him because she trusted him. And he said, I am Doña Maria, and I now it's me who needs. And so you establish a trustful relationship so they can refer to each other. The issue is that I think we have to avoid a practice that has been running out there for many years, that okay, we are the science, we know, the others don't know, because that's not, we cannot provide answer to all those needs, and the community plays a very important role. So we have to establish there some trust and get to know each other, and in the same way educate in order to make this traditional healer aware that up to here, yes, a bit farther may be dangerous. The person may be paying the consequences. So that would be
As we move from traditional healing to another form of healing, which is self-medicating, substance abuse, alcohol abuse, again, with the people that might be suffering from mental illness may not be aware that, again, they're suffering from mental illness, yet substance abuse and alcohol abuse plays a role in their self-medicating. How prevalent is this problem along the border and in the countries that, again, where people are immigrating from into this country?
Again, I have no figures for the situation specifically around the border, but I can tell that the best treatment for people suffering from alcohol abuse may be to limit the alcohol consumption. And there is a lot we can learn from the US in these policies, right, on how to restrict the alcohol availability. It's one of the most effective policies. Now, there is in many of our cultures, the alcohol consumption is part of the culture. The policy should be to limit that anyway, and how to offer treatment for people. When I was telling about the treatment gap, when we talk about people with alcohol-related disorders, we are talking about 80% of them not receiving any treatment. And there are interventions that are very basic, that may require 5 minutes of time of a general practitioner to intervene with a person that is with problems of alcohol consumption. In terms of self-medication, I don't think that's a problem of mentally ill. Mentally ill may receive medication and have it, hopefully they may have it and be better. The problem of self-medication, and I'm not aware that it's bigger in these communities rather than in others, it may be the other way around, and it's again a problem of education and a problem of, I think, control and limit the availability of certain drugs.
Well, as we again look at the Latino communities along the border, lack of medical coverage, it plays a big role. What are some alternatives to provide mental health as a basic human right, as we talked about earlier, to these communities that lack coverage?
When we talk about the treatment gap, and I'm repeating myself, and then it is clear that it's really an important concept for us, we think that probably we will never have enough specialists to deal with that problem. We are saying that 1 every 4 person will have one time in his or her life a mental disorder. So it's a lot of people, a lot of needs. So one of the strategies that we have been working heavily on is to integrate mental health into general health care. And that's on one side is the decentralization of services I was mentioning before, but on the other side is also in terms of training. The physicians, they receive training on mental health once upon a time early in their career, and they receive a few months of some knowledge and that's it. And then the tendency for them is, oops, this is a mental health problem, let's send it to refer to somebody else. Now what we are trying to do is to introduce refreshing their knowledge and perhaps adding new knowledge so that they can be able to identify and treat some conditions. And the same is going on, so this is the level of what we call primary health care. General practitioners, nurses, doctors working on emergency sites, services, etc. Then we have the other level would be what we call in Spanish promotoras de salud, the community health workers. That is also something that exists not only in the Latino world, but are those resources that are at the community level that you can again train into, according to the level, into some specific issues on how to identify, refer, what kind of support they could offer. If somebody is stressed because something happened, it may not require, let me put it in another way. If we talk now and I cut my finger with a piece of paper, we are not going to call the best surgeon in town, right? We are going to, you will give me a Band-Aid and that's going to be enough. Then if the cut is a bit more serious, we may try to find a nurse or somebody that will do something with me. If I cut my finger, as I did once actually, then we go to a surgeon. The same would be with mental health. So the community health workers that are there in the community could play a role, could offer support and work with the other levels of specialization on mental health that are there in the system.
As we wrap up the conversation today, where do you see mental health in our border region and just throughout the United States for Latinos in the next 5 years?
Well, I think we will move ahead. I'm confident that we are. There is an awareness movement that is mental health is becoming more and more visible in the agenda, and that will have as a consequence, I'm sure, better services for people. So the problems will still be there, unfortunately. Luckily, some stress-related ones or violence-related ones will decrease, but then the services should, I believe, will increase as well.
Well, Devora Kestel, thank you very much for coming in. And here on Fronteras, a Changing America, a special edition on Latinos and mental health, from stigma to treatment. If you'd like to learn more information about this program, please visit our website at krwg.org. Thank you.